Thank you for making time to be part of this beautiful program. For those who are not around yesterday too, this is how the structure goes. The first speaker is going to speak for 40 minutes. Then we'll have a question and answer session, which goes for 10 minutes. Then the next speaker will speak and follow that same pattern. Now, without taking much of our time, I would like to read the citation of our first speaker. I'll be sharing my screen. Can we see my screen?
Yes, we can see your screen, please.
Yes, ma'am.
Thank you. All right. Dr. Adebola Adebari is an experienced cardiac physiologist with specialist expertise in transthoracic and stress echocardiography. Adebola's journey into cardiac physiology was shaped by a deep curiosity about how the heart functions in both health and disease, alongside a desire to translate physiological science into meaningful real-world patient care. Passionate about healthcare and clinical research, Adebola combines hands-on clinical practice with a strong commitment to lifelong learning. He is particularly enthusiastic about encouraging physiology students to recognize how the academic training can evolve into impactful and rewarding careers in cardiovascular science. Why are you people not clapping? I need to see your virtual applauses. Adebola holds bachelor's and master's degree from Madonna University, Nigeria, and also Lagos State University, respectively. He is happily married to fellow cardiac physiologist, sharing both a personal and professional appreciation for the field. So with a virtual applause, please join me. You can also use heart emoji. Join me as I welcome Dr. Adebola Adebari. Sir, you can have the floor.
Good evening, everyone. Thank you so much. Thank you so much. I appreciate you. Thank you. Good evening, everyone. Let me just say this. I'm not a doctor. Maybe, I don't know, maybe in the future, a PhD might just, be something I'll be considering. But for now, I'm just Mr. Adebola. Thank you so much. Before I continue, I just want to appreciate the leadership and organizer or the organizers of this meeting, the ESCOs of the Students Physiological Association of Nigeria Southwest Region Zone D. Thank you so much for the honor. And I see my big brother on the meeting as well, Mr. Gbadamosi. Thank you so much. Thank you for facilitating this. I appreciate you and I honor you as always. Thank you so much. So without further ado, I'll just go straight to the presentation. I've been told I have 40 minutes. So I'll try and share my screen. Okay. Can you see my screen? Can you see my screen?
Yes, sir.
Okay.
Yes, sir. Yes, sir.
Okay, thank you. All right. Let me just move this to the left. Okay. Okay, so I've been asked to speak on careers in clinical cardiac physiology and the career pathways in cardiovascular physiology. So as we all know, physiology has got different systems from cardiac to neuro to renal, nutrition and all the likes. But cardiac is my own specialty. It's where I'm interested in. So I will be speaking in that regard. And I'd like to say this. Please, for those who are still in school, or for those who are still trying to find their way as to which area to pitch their tents, I'll say have an open mind. Have an open mind. I know, yes, maybe CVS is your area that it's your favorite, but please have an open mind. I say you never can tell, and the most especially in Nigeria where most of you are at the moment, the opportunities are not really there. So I'll encourage any time, be it in sleep, be it in neuro, can you just take that first to build and transition to whatever you want. So before I start the presentation proper, I would also like to say this. I intentionally put that stated emphatically that the education I had was in Nigeria, both BSc and MSc, and I intentionally put that because I want you to see me like one of you. You know, I feel what you feel. I understand that uncertainty. I understand that fear. I understand that concern. Like, what do I do with this physiology thing? You know, what am I going to do with it after school? Everybody who has made something out of physiology, trust me, at one time or the other, you know, they felt the same thing. They felt the same thing. They felt the same way. But the truth is, you can always do something. You can always do something. And that's why I love to share my own story. And another reason why I'm grateful to the organizers of this is that this is even making the picture clearer. You know, in my own time, we didn't have this opportunity of somebody even coming to speak to say, oh, these are the things you can do, these are the areas you could delve into, and all of that. I had to figure this out on my own, and of course, at some point, with the help of some people who had gone before me. So please listen attentively and have an open mind. And if there are questions at the end, I'll I'd like to take them. Okay, so let's just go into this. Every heartbeat tells a story, and cardiac physiologists help to interpret it and save lives. Just like every other area of diagnostics, you know, diagnostic medicine and all of that, physiology, physiologists who work in the clinical space, irrespective of their subspecialty, they help to interpret many of these tests and they save lives. Trust me, a test as simple as the ECG can save life. It can save life. In fact, it has saved lives many times. So trust me, the physiology you are reading, there's a lot more to it. It might be in the elementary form, you know, in the basic form, you know, but trust me, if you have that knowledge and it's sound, that foundation is sound, it's going to be very easy for you to, you know, to progress into something else. So for this session, I'm going to be speaking around what is clinical physiology, the roles and career pathways, the skill you need, opportunities in Nigeria and abroad, and how to start your career now, and then future trends in cardiac diagnostics. Those are the things that I'll be speaking on. Sorry, I'm just trying to get my image out of the way. It's interfering with my slides. Okay, I think it's okay now. So what is clinical cardiac physiology? What is clinical cardiac physiology? So it has to do with the study and the assessment of the heart function. The study and the assessment of the heart function. From your cardiovascular physiology that you do currently, or for those who have finished school now, the ones we all did back in school, that is the basics. It talks about the heart, it talks about the blood vessels, and of course, if you combine that with your anatomy, it tells you the location where the heart is. It talks about the chambers, it talks about the structure, the valves, and all of that. So that is the basics. That is where it starts from. For you to be able to understand what the abnormal heart looks like, you need to know what the normal one looks like. And that's where that basic knowledge stems from. You're not just going to skip that process and then start to talk about what is abnormal or how do you assess. You need to understand what you want to assess in the first place. And that's why I said this physiology you're learning now is very relevant. It is very relevant. So another thing that clinical cardiac physiology entails is the use of diagnostic technologies. It involves the use of diagnostic technologies. By that, we mean the different machines, the equipment that are used in cardiac physiology, from the ECG machine to the Holter monitor to the pacemaker programmers, the echo machine, ultrasound, and all of that. I'll be showing you some of those in the course of this presentation. And then cardiac physiologists are a member of a bigger team, which is the cardiology team. They are members of a bigger team, which is the cardiology team. So when you hear of a cardiologist is first of all, a medical doctor who has specialized in the area of cardiology, that's specialized in the area of the heart and the blood vessels and things like that. So they don't just treat patients. When a patient is referred to the cardiology clinic, the cardiologist wants to get the basic, wants to get some assessments of that patient. Is sending the patient, go get your blood pressure done, go get your ECG done, do a cardiac ultrasound and things like that. So, and that is where the cardiac physiologist comes in. The cardiac physiologist is doing the ECG, is doing the echo and all of that, and interpreting it and then sending it to the doctor. And then when the doctor has all of those test results, he puts them together and then make decision from there. So you can see that we are part of a team. Cardiology is part of that team. So the doctors don't treat in isolation, so they will need you at some point. They will need you at some point if you are part of the the team. So you can see that we are not just an appendage. We are very significant. I can't imagine where I work. I can imagine a situation whereby the cardiac physiologist where I work have a shutdown and say we are not showing up at work today. It means nothing is going to happen. It's as serious as that, because if there's nobody doing ECG, nobody is doing Holter, nobody is checking pacemakers, nobody is doing echo, then there's nothing for the cardiologist to work with. So we are that important. We are that important. Okay, so why does this career matter? Career in cardiac physiology, why does it matter? Cardiovascular diseases are leading killers in the world today. As the world gets more, how will I put it now, more sophisticated, we're doing a lot of junk foods, fatty foods, and unhealthy habits, and even aging. Sometimes you can even live well, but aging, wear and tear of your body parts and all of that, you need cardiovascular professionals in the cardiovascular space to be able to, treat people, to be able to manage people. And so when you look at it, I'm sure every one of us around us, you can tell there's someone who is suffering from high blood pressure, there's someone who's got stroke, there's someone who has had one cardiac disease or the other. You can, without you even blinking so much, you can tell you've had somebody somehow. So it's as big as that. And it's not just restricted to Africa or Nigeria alone. The world over, it's like that all over the world. So those people are going to need treatment. They are going to need their heart status to be assessed. They are going to need different tests, and that is where you and I come in. And of course, early detection improves outcomes. Early detection improves outcomes. So when these diseases are detected early, it makes it easier for them to be managed. It makes it easier for them to be managed. And of course, there's a growing global demand. There's a growing global demand. And I've intentionally put the global thing and the international thing into this slide because I don't want you to think local alone. Don't restrict yourself to Lagos or Abuja or Abeokuta or Ibadan or wherever you are. Fine, you might be starting out there, but what you have in your hands, if you build it properly, if you follow the roadmap, trust me, there's nowhere in the world that you cannot practice. There's nowhere in the world that you cannot function. All right. I mean, I have colleagues that maybe we've worked at one time or the other together in Nigeria and they're in different places. I have colleagues in the UK, I have colleagues in Australia. There are people that I know who do this same thing in America, in Canada. So there's a growing demand globally. There's a growing demand globally. So we are that important. I'll say that again. We are that important. So what do cardiac physiologists do? What do we do? When you say someone is a cardiac physiologist, what are the things they do? So they record and interpret ECGs. What is ECGs? That's electrocardiogram. Electrocardiogram. From our CVS, I'll go back to CVS again. I'm sure we all learned about the conducting system of the heart, the sinoatrial node, the AV node, the bundle of V's, the porcine fibers, and all of those things. That pathway, how it travels, how impulses are transmitted along the cardiac muscle. So the ECG takes us through that journey from the onset, the atrial contraction, the ventricular contraction, the repolarization. So it's a graph paper and you just see the lines. You see the lines of the P wave, QRS, and all of that. And from that little paper, you can make out a lot of information about the status of the heart. So the cardiac physiology performs that test on the patient, and some people are able to read that test. All right. And of course, they perform exercise stress testing. What is exercise stress testing? Is another form of ECG, but a bit more advanced. And the reason why that is done is because when you do the regular ECG, the normal ECG, the basic ECG, the patient is just lying down, and then you just hook the patient up, and then you print out the paper. In some cases, some people, the symptoms they have comes on exertion. So you hear people talk about chest pain on exertion, you hear people talk about shortness of breath on exertion and things like that. So you want to create that scenario of the person being exerted. Maybe the person is when the person is jogging or exercising, that's when the person feels that symptom. So what we do is we hook that patient up the same way you hook them up for a basic ECG, and then you put them in a stress condition. And the one of the most popular one is the treadmill. So the patient is on a treadmill hooked up with all of those wires, and then the patient starts to exercise, and then you monitor the changes on the ECG, and of course you ask for symptoms, how are they feeling and all of that. So that is exercise stress ECG. And of course, they support echocardiography services. Echocardiography is just ultrasound of the heart, ultrasound of the heart, just like the baby scans, the baby scans that they do for pregnant women. You can do the same for the heart. And when you do that, you are able to see the different chambers of the heart. You can see the valves. You can assess the muscular contraction and all of that. When they say someone is in heart failure, how do you find out that? Do you make those diagnoses? They say somebody has a valve problem. The mitral valve is leaking, regurgitation. The mitral valve is narrow, or the aorta is enlarged. How do you make those diagnoses? You can make those ones with ECG. I'm sorry, with echocardiography. And of course, they assist in cardiac catheterization. What is cardiac catheterization? Is another diagnostic test that looks at the coronary arteries. So when someone has a heart attack, what happens is as a result of narrowing or blockage to one of the coronary arteries. And for you to be able to um, um, find out which of the artery is blocked, you need to take the person to a cath lab, and then they insert a catheter either through the wrist or the groin, in a live X-ray room, which is called the cath lab. They inject a dye, which is called contrast, and they begin to look at the arteries. And then when they locate it, they can open it up. So that is cardiac catheterization. And they also support in diagnosis of rhythm disorders. So some people have reading, abnormal readings like the atrial fibrillation, the SBT, and all of those things. And they fit and monitor ambulatory devices. So you have the Holter and BP monitors, whereby they hook the patient up for 24 hours. The patient can go home with the blood pressure machine. They ask them to take it home and bring it back the next day, and it is downloaded and then it is analyzed. So those are the different cardiac investigations that cardiac physiologists will do. So, why physiology graduates are well positioned? Why are you well positioned for this? You have strong cardiovascular foundation. Like I said, your CVS, take it seriously. For those who are still in school, study it properly. And in fact, you can even take it a step further now. After you have studied, you've read those topics, you can just do a little research, go on ChatGPT yourself and ask, what is the applied physiology of this thing that I have learned? I've learned about the conductive system of the heart. What is the applied physiology? In other words, what is the application? How is it relevant in the clinical setting? So, strong cardiovascular physiology foundation, and then you understand a bit of pathophysiology. It's one of the courses I took in my final year. I can still remember that pathophysiology. These disease patterns. What are the differences? What makes it different from a normal situation? So you have that knowledge, and of course, research and analytical skills. By the time you're writing your final exam, before then you'd have done your project, so you can reason, you can do a bit of research, you can analyze things. And then clinical reasoning potential. There are things you can develop even before you even get into the job market. So you can see that you already have some of these things already. Even without you getting the job yet, you have some of these things. So you just need to now take it more seriously. If you have been treating it with levity, now you need to pay more attention to it and do more research with it. All right, so I'll go to the next slide. So, where can physiology lead me into? Where can it lead me? Diagnostics, diagnostics is one of the major areas. That's you conducting all of these tests, the ECG, the echo, and all of that I spoke about. Clinical science. Some people will go into clinical science. That is a bit more academic, clinical science. Medical technology, that's another area that is thriving now, that is gaining traction. Medical technology. So with your knowledge of the basic physiology, and then probably if you've worked in the hospital setting for a while, you can partner with the tech people to design some of these things, like your Fitbit that people wear during exercise, your Fitbit, your iWatch, and your Apple Watch, and all of those things. It's a combination of the tech people and the people, the medical people, the medical professionals. They both come together to design all of these things. And of course, research. You can go into research, and then you can go into industry. Many of the equipments that are used in the hospital, in cardiology, they are made by industries. I will throw more light on that if time permits me. So you can work in the industries as well. So these challenges that idea that physiology is only restricted to lecturing or medicine. In fact, you can spend the whole lifetime of your career doing one thing or the other in physiology without having to lecture, and you'll still be fulfilled. So these are some of the areas that you can function without going into the classroom. So what are the core skills needed for you to say, oh, I'm a cardiac physiologist? What are the core skills that are needed? ECG interpretation. It is very important. You might not become the super interpreter, but you should be able to identify some basic things like the rhythms. You should be able to tell what the rhythm looks like. Is this patient in sinus rhythm? Is it in bradycardia? Is it in atrial fibrillation, heart block, and things? Basically, basic things. You should be able to tell, even if you don't know the right thing, you should be able to tell this thing is not normal. At least from there, you can reach out to a colleague, or maybe the cardiologist and all of that, to tell, depending on which area of cardiac physiology you're working in anyway. And of course, echocardiography basics. You should be able to identify the anatomy. When you see an image of cardiac ultrasound on the screen, you should be able to tell this is the left ventricle, this is the left atrium, and things like that. And then cardiac monitoring, which is similar to ECG interpretation. Medical instrumentation, the equipment that are used within cardiac physiology, you should be able to identify them and know what they use them for. And of course, data analysis, meaning that when you have the data, you should be able to make something out of it. What can you deduce from these echo images? What can you deduce from this ECG? So you need those skills. And in addition to the skills I spoke about earlier, those are the core skills, the hard skills. You also need the soft skills. The soft skills. And trust me, the soft skills, you don't even need to get on the job before you begin to learn them. You can start to learn them now. So what are the core skills that we need? Problem solving. Problem solving. You always be faced with one problem or the other. So you should have that mentality of someone who wants to solve problems. Soft skills. A soft skill. It will make you more valuable on the job. Patient communication. You should be a good communicator. A lot of times the patient walks in, they are scared, they are anxious, and all of that. You should be able to communicate, calm them down, make them feel relaxed. You must be friendly. You can't be, no matter how skillful you are, you can't be carrying heavy face. You can't be yelling at your patient. No. It's like you having a business. It's customer service. Patient communication must be sound. You should be able to explain the test to the patient in such a way that they can understand what you're about to do. You don't just say, oh, lie down there, and you just start to put on wires on them. No, it's not done that way. You welcome them. Good morning. How are you doing today? You introduce yourself. My name is so, 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 and so, and I'll be, performing an ECG test and all of that. This is what the test entails. It's just to assess the electrical activities of your heart. And you even ask them, have they got any question? No, then you go ahead and do all of those things. So you need those, you must be a good communicator. Teamwork. You can't do it alone. You can't write solo. Like I said, we are a part of a bigger team. You are a part of a bigger team. So you should look out for your colleagues as well. Look out for your colleagues. Attention to detail. Attention to detail is also very important, because many of these tests, these changes, what might be abnormal in a test might be something very subtle. But if you miss it at your own point, if you miss it, it can affect the overall diagnosis the doctors are going to make on that patient. And that might be costly. So attention to detail is also very important. Clinical decision support. So when you are making decisions, if you are not sure, get a second opinion, get your colleague's opinion. There's nothing to there's nothing to be proud about. There's nothing for I know it all. Nobody knows it all. Till tomorrow, I will ask my colleagues sometimes, what do you think about this image? What do you think about this study? So these are, you can see that all of these soft skills, there's nothing special about it. There are things that you can learn by yourself, you can work on, develop yourself to be able to do some of these things. So I'll be talking about the career pathways. There are a few career pathways, even within cardiac physiology, there are a few cardiac pathways. So I'll talk about the cardiac physiologists and the cardiac scientists first. So those are the ones who do the resting ECGs, the Holter analysis. I've spoken about the resting ECGs before, so I won't spend more time on that. So what is Holter analysis? So it's a small device, just like the blood pressure thing too. They just hook them up on the patient. So some patients, they complain about palpitations, they complain about maybe sometimes shortness of breath and all of that, but it's difficult to capture that exact time when that symptom comes up. For instance, the palpitation might come at a particular time of the day, but when they come to the hospital, the palpitation is not there. So it's difficult for the doctor to be able to tell what is going on because it's not happening at that time. So what they do is to get a device that can capture the ECG of that patient, the electrical activities of that patient over 24 hours or 48 hours. So they hook the patient up and they tell them you can go home, go about your normal activities. They give them a jotter and a pen and say, okay, whenever you feel that palpitation, take note of the time when that thing happened. And after the 24 hours, you bring it back. So when they bring it back, there's a memory card on that device. It's downloaded by a cardiac physiologist and it captures the ECG of that patient throughout the 24 hours. So by so doing, they now analyze and then they are able to match the time the patient complained of the palpitation from the jotter and what they are reading on the screen. So that's how the Holter analysis works. And ECG testing, like I said, the one the exercise on the treadmill while they monitor the ECG, and of course ambulatory blood pressure monitoring is similar to the Holter analysis as well. The difference is that ambulatory is capturing the blood pressure reading over a certain time, over a certain period of time, and of course diagnostic support, which is more like overview of everything I've said. So you can see, if you can see my cursor, I don't know if you can see it, but it's labeled. That's what an ECG machine looks like. And you can see the ECG paper there printing out the lines. So what you'll see in those lines, they are waves. I'm sure you've done a bit of that in your CVS. And that's an ambulatory blood pressure. There you can see the cuff. They just strap the patient up and they take it home with it. The Holter monitor as well. So those are some of the equipments that they use. So that's a stress ECG. Oh, very good. That's a stress ECG. You can see the patient on the treadmill. You can see the ECG wires all over his chest together with the blood pressure cuff. The lady in scrub, I guess that should be a cardiac physiologist, and you've got the doctor, maybe a cardiologist in the room. So while as the patient is exercising, they are monitoring the ECG on the screen. You can see the screen, they're facing the screen. So they are monitoring the screen. So cardiac physiologists do all of those things. And of course, this is another career pathway too, which is cardiac sonographer, echocardiography specialist. So this is my own specialty. This is what I do. So they use ultrasound to assess the heart structure, the valve disease, heart failure, congenital abnormalities. Yeah, congenital abnormalities. I think it was just this week that ended. Last week. A young lady just came in for an echo. Indication was palpitation. And midway the echo, I just discovered that something wasn't right somewhere. One of the chambers was becoming enlarged. And by the time I took a closer look, she had an atrial septal defect. So what they will call hole in the heart. So the membrane that is supposed to partition the left atrium from the right atrium had a perforation somewhere. So that we'll call that ASD, atrial septal defect. I was able to make that diagnosis with an echo, with ultrasound. And all they need to do is just take the patient to the theater, and they don't even need to do an open heart surgery nowadays. They can do a keyhole and just deploy a device to block that opening. They call that an amplatter, if I can, amplatter. So they just cover it up and she'll be fine and all of that. So those are some of the things we can do as a cardiac physiologist. Okay, so that's an echocardiograph there on your screen. It's an ultrasound machine, just like the baby scanner, like I spoke about. And when you look at your screen, that's the image of, that's what the heart looks like on ultrasound, but it's an inverted and a mirror image. So in real life, you have the two chambers on top, you have them below. So the two chambers on top are the ventricles, the one below, those are the atria. All right. And there's a color on the screen. That color is just an application from the machine telling me the direction of blood flow. So that's what an echocardiograph looks like. So there's another subspecialty again, which is a bit more advanced. It still has to do with imaging. So advanced echo and then stress echo. So just the same way we do the stress ECG where you hook the patient up and then they do the ECG, you can also do the same for echo. So you can put the patient is exercising and you are taking images of the heart. Yes, it is possible. There are some beds that comes with pedals. So the patient is strapped on the bed and is pedaling while he's still lying down. He's pedaling on the bed and you are grabbing images. So that's the stress echo. And then transesophageal. Transesophageal echo looks like the endoscopy test. So the patient, they insert the camera into the mouth of the patient. It goes down and they're able to take a close-up image of the heart. And of course, structural heart imaging, that's imaging in heart defects and things like that. So these are a bit more advanced than the basic echocardiogram. Also, there's another career pathway which has to do with the cardiac catheterization and cath lab specialist. Like I spoke about earlier, when there's a blockage in the coronary arteries and they need to open it up. So coronary angiography is the test when they inject the dye to see where the blockage is. And then they can do angioplasty and stenting, opening up that coronary artery. And other structural heart procedures like the one I spoke about, closing a hole in the heart, and then device implantation support. So that's pacemakers. So for people who have problems probably with their sinoatrial node in such a way that the heart rate now becomes permanently low and they have symptoms, we call that symptomatic bradycardia. So their heart rate is below 60, maybe the heart rate is about 40. They will definitely be breathless because it will affect cardiac output. So you need something to kick up that heart rate. So they implant a device in their chest, which has got wires, leads that goes into the heart, and that is able to help kick up the heart rate a bit. So that's called a pacemaker. I think I have an image of that on this slide. So you need for them to implant that, you also need a cardiac physiologist to do the programming and all of those. So that's that. So this is a cardiac catheterization lab. You can see the bed. That's where the patient lies down. On that screen, you can see something that looks like a tree, branches of a tree. That's the coronary artery. And that's where they look out for the blockage and all of that. And there's a lot of radiation going on in that room. So that's what the cardiac catheterization lab looks like. There are a couple of them in Lagos. You can find out and just go there just to observe and see what's going on there. So the career pathway 4 has to do with electrical activities of the heart as well, which includes EP studies, pacemaker follow-up, like I said, arrhythmia investigations. So there are some very dangerous arrhythmia. That's abnormal rhythm, that if someone goes into it, if something is not done as soon as possible, the person could pass from there, like the supraventricular tachycardia and things like that. You just said that somebody was playing football and he slumped and he died. It could be from those arrhythmia. So there's another device that they can implant in the chest, which is called ICD. That's a defibrillator. It's like the one we watch in the movies where they shock the patient. So that device is already in the chest. So the moment it detects any abnormal reading, it shocks the patient back to sinus. So those are so in checking those devices from time to time, a cardiac physiologist can do that. So these are programmers. These are different pacemaker programmers. So it's got a big metal. They just put it on the chest of the patient where the pacemaker was inserted, and they can analyze and program the pacemaker from there. So this is a pacemaker program. So yeah, beautiful. So this is what a pacemaker looks like. So they implant this into the chest of that patient. So in those people, you will notice that bulge on their chest. You notice that bulge. So the accompanying wire is the one that goes into the heart. that is implanted somewhere in the heart. Usually, mostly on the right side of the heart, they implant these ones. Yeah, so that's what a pacemaker looks like. And so beyond the traditional hospital roles, there are other areas where cardiac physiologists could work, like the cardiac device industry, like I said. I will mention some of them in the subsequent slide. The cardiac device industry, clinical application specialist. Who is a clinical application specialist? There are some people who do these demos. Usually, many of them started as cardiac physiologists, maybe as doing ECG, doing echoes, doing catheterization and all of that. And then they transition into industry, and they are the ones that work for those companies that make those machines. So they are the ones that interface with the consumers, the cardiac physiologists on the job. They show them, oh, we've got a new echo machine. It can do 4D, it can do this, it can do that. So they are the ones that do those demos. So those are the clinical application specialists. You can also go into sales, medical sales, scientific support, digital health and wearables. Like I said, your Fitbit, your Apple Watch, and all of those things. AI in cardiac diagnostics. There's AI is everywhere, of course. Some of the measurements that it takes us a couple of minutes to do before, that you have to manually measure and trace and do all of those things. With AI now, you just punch a button and it will calculate everything for you, analyze everything for you. That's what AI is. And then research and academia, clinical trials. So those are other things that you can do. So the industry players, Medtronic, Abbott, Philips, GE Healthcare, Siemens Healthineers. So these are different companies that they are actively looking for people with cardiac physiology background to come and work with them, either as a salesperson or as an application specialist and all of that. So there are also cardiac physiologists that work in industry. I think I have somebody on this slide I'll show you. She started as a cardiac physiologist, worked as a cardiac physiologist, did echoes, became a manager in her department before she went into industry. So you can also work in the industry. And international opportunities exist across the world. Like I said, from UK to Canada to US, Australia, Saudi Arabia, United Arab Emirates. So don't just limit yourself. That's why you need to take this learning seriously. As you are learning, don't look down on those humble beginnings. Even if it's ECG that you can find to learn now, take it seriously. You never can tell where you find yourself. You can just find yourself in another country, and it will be these skills that will make that difference for you. All right. So yeah, this is the image of the person I was talking about. So that's my humble self with that colleague. Their name is Natasha. So she used to be an echocardiographer as well. She became a manager in a trust and then decided to go into industry. So she joined General Electric, and I think on that day she had come to market that machine behind us, to us in the hospital. And on that screen, you can see a 2D and 4D image there. So there are no limits. There are no limits. You can start in the hospital and end up in the industry. So that is very possible. I just needed to put that image there so you can see that these things happen. I'm not just making them up. So where do you start? I know my time is up. I'm rushing now. Where do you start? How do you start? Get hospital exposure. I did that as well. Get hospital exposure. Reach out to hospitals that do many of these tests, that offer many of these services. Approach them, be humble about it. Let them see the hunger in you. And who knows, they might just give you that chance. Seek cardiology unit observations, observerships. Go to LUT, go to LASUT, see what they are doing. Take short ECG courses. I know that there is Vitakura that, offers some of these courses. Take those courses, learn echo fundamentals, volunteer. Everything doesn't have to be money. Don't say how much are they going to pay me. Volunteer. It's part of you showing that hunger. For somebody to invest in you, the person wants to see that seriousness. So if you can do it for free, then they will take you more seriously. And also build LinkedIn. Your LinkedIn profile, build your LinkedIn profile, network professionally. Network professionally. When you see people who are doing what you aspire to do, connect with them on LinkedIn, and don't just go there and say hi or say good morning and you expect them to start chatting with you. Many of them are very busy. They don't have that time. If you have anything to say, go into their message, this thing, send them the message properly. Introduce yourself. This is who you are. This is what you want them to help you with. and I'm sure many of them will reply you. But when you go there and you're chatting, you're saying good morning, you are waiting for them to reply you and all of that, they might not have that time to do that. And then find mentors. Find mentors. Look out for people that can help you and be humble. When they give you their space as well, when they give you their space for you to come and observe and all of that, be useful. Try as much as possible, add value to them. If somebody is doing an echo, for instance, and the person invites you to come into the lab, even if it's just to change the sheets, the paper, to tidy up after every patient, that you can do it. If it's just height and weight, do it. Let the person see that there's some seriousness, there's some value attached. That's how you gain attention. People do not just waste their time to start investing in you like that. It's not like you are related or something. They just saw you, but they need to see that seriousness, and that's how you can get access to people. All right. So let me see. Have I got anything left? So what are the challenges? Of course, there are challenges. It's not as easy as it sounds. Limited training facilities. We haven't got enough facilities that are offering many of these tests for people to even get exposure. All right. And then continuous learning is required. You don't just finish your BSc and you just pack things up and say, I want to hit the market like that. All right. Technical competence takes time. You need to be patient with yourself. Don't be too hard on yourself. All right. It takes time. So that process will always be there. And then some regions have limited awareness of this profession. To the best of my knowledge, there are still many other states in Nigeria that we are not even seeing people doing anything in that area. The attention seems to be on Lagos, Abuja, Port Harcourt, and maybe a few teaching hospitals across. But there are still so many areas where many of these things don't even, if you tell them you study physiology, they'll just look like what's that and all of that. So those challenges are still there. All right. So key takeaways: clinical cardiac physiology is a real and growing part, and it's fast developing, fast growing. And physiology graduates already have relevant foundations. You already have that relevant foundation from your degree program that you're taking. And then there are multiple specializations. Opportunities exist locally and internationally, and I'll encourage you, start building your pathway now. For those that are still in school, when you're on your semester breaks, try and go to visit some of these hospitals just for a tour. See what is going on. See what is obtainable. Make use of the internet. What are the things? I remember doing that at some point when I got confused, and I'm like, this physiology, I'm sure there are some people outside the country that studies it and they are working professionally. I went on YouTube. What does it mean to be a cardiac physiologist? What are the things they do? So you can do that as well. All right. So final advice: explore early, be curious, build competence, seek mentorship, and position yourself intentionally. All right. I think that should be the end. Thank you very much. And I'm happy to take any questions. Thank you.
Thank you very much, sir. That was beautiful. Not only did you wrap it up, but you even finished before time. I appreciate that, sir. All
Thank
right,
you very
so
much.
any questions in the house, you can type it in the chat box, please. For those watching on YouTube too, feel free to ask questions. Okay, sir, there's a question from me.
Okay.
It said we should volunteer for research projects. That we should volunteer. We should not care about whether the pay is there or it's money is high or anything. Is it specific research projects or the ones that are in line with cardio? Because I hardly see research projects with that kind of subject. And where can we find such? Is there a website or a particular place you can search to know people that are doing research, looking for volunteers?
Well, to the best of my knowledge, I am not aware of any website or things like that. And what I would advise in that regards is visit those hospitals, most especially the teaching hospitals like Lutz, like Lasuth. I don't know much about many other teaching hospitals. Try and get access to the cardiac department, the cardiology department, and ask questions. If you don't make those research, if you don't search, I'm sorry, I'm a Christian. It says, seek and you will find. It's what you search that you will find. It's what you're looking for that you will find. So be intentional. Go to those places, knock on doors, ask, how can I help out? How can I volunteer? How can I assist you? And all of that. So I think that's the best way for now that you can get those opportunities. And I know people who started that way and now they are big now. I know people who started that way. They were just research assistants. They were just more like boy and all of that. But they knew that they were going somewhere, you know. They knew they were going somewhere, and the moment they had that opportunity, that is just for you to gain access. And by the time you get that access, because you already know what you are looking for, you can maximize it. So that's what I would say. Knock on those doors, visit those departments, and you never can tell what will come out of it.
Thank you very much, sir. Noted, sir. All right, so one of the questions from the house is this: must physiologists get international certification before they can get jobs abroad?
Um, Not all the time, not all the time, but it just gives you an edge. It gives you an edge. Like I tell people, the world is competitive. Yes, there's a growing demand. There's a growing demand, but it is still competitive. So imagine you are applying together with people who already have one or two certifications and they are doing the shortlisting. Who do you think will be more preferred? So it's just to put you in a better place. There's no one size fits all, but it just puts you in a better place. And also it gives you that confidence too that, I'll use my own experience for instance. After I had worked in Nigeria for about 4 or 5 years, no, about 4 years, I thought to myself, I think I have what it takes now. But for me to be able to measure the knowledge I have on echoes, I started researching, is there any international exam that I could take and all of that? And I stumbled on the registered cardiac sonography exam by the Cardiovascular Credentialing International. And luckily, they take that exam in Nigeria. So I tried to save up the money, applied for the exam, and then wrote the exam. The moment I wrote the exam and I passed well, that builds my confidence that yes, I have what it takes. So it gives you an edge. It gives you an edge and it boosts your confidence. That's what I'll say.
All right, so I believe that answered the person's question. Okay, the other question we have is this: can you recommend any learning center? Like you just mentioned how you were able to find out about the exam that you wrote that gave you an edge.
Hmm.
So is there any learning center that you can tell us
Any
about
learning
that?
center?
Yes.
Well, for now, I let me see. For the learning center, it's easier for you when you when you've gotten that opportunity, when probably you got a job in that line. It's easier because you're learning on the job as well. So it gives you a better advantage depending on the specialty you are going into. If, for instance, what you want to learn is ECG for now, I'm sure Mr. Gbadamosi and his partner, their company, Vitacora, they provide a lot of this training on ECG courses. So you can start from there. You can start from there. I'm also aware of this postgraduate diploma in cardiac ultrasound. I think LASUT has started as well. There used to be one in Uyo some years back. I don't know if they still exist. So these are structured training, and then you get to write an exam and get certified. So these are places that you can find out more about. But I'm sure about LASUT. I think LASUT just started a couple of years ago now. Yeah.
All right, sir. Thank you very much, sir. And to the person who asked the question, someone recommended Vitacura. All right, so another question: which ECG course can someone take to boost
I
their
think
level?
Vitakura will be able to advise you more on that. If you go for their course, then they can pitch you for more certifications if you need that. Yeah, yeah. But the thing is, I know we like certificates a lot. I know we like to, something fancy to post on LinkedIn and all of that. But beyond that, trust me, build the skill, be competent in it first. Like I said, I'd worked professionally for like 4 years. I was already doing my scans, doing my reporting and all of that before for a couple of years before I even thought about an exam. So if you have that opportunity to learn, just don't worry, the recertification will come later. When you get called to an interview, there's a way you speak at the interview that they won't even bother whether you have the certification or not. There are some people who have those certifications and they can't even defend it. They can't even perform on the field. So I'll say it's a blend of both, but don't let your attention to be more on the certification, than getting the required skill, the competence. All right.
Yes, sir. Like you said, skill is very important. Okay, so someone asked, are there any cardiac physiology rules in the fitness or sports science?
Well, yes, but I'm not sure if there's anything like that in Nigeria. I'm not sure. But the truth is, many of those fitness and sports people, they reach out to the hospitals when they need to probably get their athletes for evaluation and assessment. They don't most of them will not hire a cardiac physiologist to do that, except probably you've been in it for many years and maybe you have a company. That's when they can approach you. Most likely, they will go to the hospitals to say, okay, we have about 10 or 15 athletes who needs to have their trials or medical fitness. Can you put them into your schedule and all of that? So that's how many of them will do it. They will approach the hospitals, not hire somebody, a cardiac physiologist to do that. So they still go back to the hospitals anyway. Yeah.
Okay, sir. So the person that asked that, please put yourself out there. Another question for you, sir. How can a physiologist play a role in a respiratory unit?
Yeah. We have a lot of physiologists in the respiratory space as well. I think they do that in Lutz. If you go to Lutz, let's not underrate our own. There's a lot going on in Lutz and Lasut. Get to those places, approach them. It's the way you carry yourself. Go there, be humble, let them introduce yourself, let them know you just want to see and all of that, and they will show you some of these things. There's nothing hidden about it. For a physiologist, you also help in carrying out many of those diagnostics tests. They have the lung function, the spirometry, CPAP, and things like that. So I know there are people in Lutz that practice as respiratory physiologists. So yes, you need to do you help out with those lung function tests and the spirometry. Yeah.
Thank you very, very much, sir. You've been a well of wisdom. Really, really appreciate it. Okay, is there any other question, anyone? Okay, someone asked which area of physiology, or rather specialization in physiology, has the highest demand currently?
Well, I don't have the data. I will need to confirm that with data. I don't have the data, unfortunately, but maybe allow me to be partial now. I know because I play in the cardiac space, I know a lot of people in that area. But I also know that there are people in neuro as well. Neuro has quite a number of people as well. Those who do the EEG and the likes. There are people in neuro. There are people in respiratory. Where else again? There are people in sleep. I think sleep and neuro kind of, they work in the same space. So yeah. But of course, I know more people in cardiac anyway. Yeah, people in
Okay,
cardiac
sir.
perfusion as well. Yeah.
No, sir, you can continue if you have something to say.
Yeah, I just saw somebody saying something about cardiac perfusion. Oh, sorry, it's a
Yes,
question.
sir. It's a
Can a
question. They
physiologist
were
become a
asking.
cardiac perfusion? Yes.
Yes, sir.
Yes. Yes. But most likely you need to go for further training. But you already have the basics. There's someone I know that used to be in perfusion. I don't know if he still does that. His name is Mohammed Gidado. I think he works with Medtronic the last time I heard from him. But he started out as a cardiac perfusionist before he started doing the pacemaker programming and all of those. Yeah.
Okay, so I believe that answered all the questions that we have answered, right? All the questions that we've asked so far. Please, anyone, if there's anything you want him to tell, you want to know, you can still drop questions. Okay, so we have this. Can physiologists work directly in hospitals after graduation, or do they need additional training?
You can work directly, yeah. Definitely you'll be a trainee. When you go into the hospital, you're going to be going in as a trainee. All right, but they can employ you. They can employ you as a trainee. The knowledge you have, like I said, the knowledge you have is in the basic form. You have the basic form. You don't have the applied knowledge. All right, so you will still need some training, but it's something that you can learn on the job. You can learn on the job. So you can get, yes, you can get employed into the hospital space, after graduation. Yeah. But of course, the training will happen either on the job or you going for a course or something.
So it's basically like learning on the job.
Yes, yes, yes.
All right, sir. All right, sir. Okay, so there's another question. For someone wishing to explore immunology and physiology, how do I go about it, both with the learning and lab? And are there any learning?
Immunology.
It's two-in-one question. Yes, sir.
I'm sorry, I'm not sure I can
It's
comment on
not
that
your
because
field.
I don't
All
know.
right.
Yeah,
All right.
it's not my field. Yeah,
Okay.
my
All right. So
specialty.
Nancy, sorry, that is not his field currently. But if you have any other questions like related to anything like cardio, please feel free to ask. All right. Sir, is it possible to specialize in echocardiography for masters?
Yes, there are a few institutions that offer masters in echocardiography, but I would say just do a postgraduate. A postgraduate should be enough for a start rather than going for a master's. That master's might be more expensive and, take longer, for you to have. But with the postgraduates, it just gives you, yes, you're not going to become a guru from, be it the postgraduate or the masters. It's something that you keep learning every day. I've been doing it by the grace of God for 11 years now, and I'm still learning. I'm still learning. So it's not something that you capture everything from day one, but a PGD should be enough for you to kickstart you. Yeah.
Okay, so thank you very much, sir. This was wonderful. A lot of people can testify to that. There's another question. What do you advise for a physiology student going for IT to work in? Okay, so basically, the person is asking, is there any specific hospital organization that they can apply to when going for IT that can equip the person for tomorrow in terms of their future?
Good question. So for me, and with the little I know about Nigeria, there's no structured path. There's no structured path. You have to work out your own way. You have to work out your way, and that's why I'll still keep hammering on you going to those places, approaching them. That's why this thing, you have to take it, is that you're not responsible for anybody at this time. Take it as your this is your life matter. So from year two, I don't know what year they go for industrial training. From year two, year three, all those your semester breaks, start familiarizing yourself with those departments. Get to know the people who are in charge. Even if it's just to go there, see what they are doing, run a few errands for them. I'm not gonna deceive you about that. If you need to run few errands for them, just anything for them to like you, for them to know you, recognize you, for them to be able to, identify you, recognize you. You are preparing your way for when you will need them. You have to be smart. This is street sense now. They won't teach you this in the classroom. Find a way to know people in those spaces so that when you need to do your IT, for instance, you can just go there and say, sir, it's time for my IT and I need a place and all of that. Please, can you just prepare a letter or something for me so I can come here to have my IT? You know, that's the only way. In Nigeria, there's no structured pathway to say, okay, these ones are taking ITs to, the truth is, in as much as it's important for you to train the next generation and train people that will take over from people that are already working now, when it comes to IT and observership and things like that, they slow people down. They slow down pace of work. They are just all over the place, sometimes getting in people's ways and all of that. So many organizations will not readily open their arms and say, come. So you have to work out your way. You need to be smart about it and see what can come out from there. So that's what I would suggest. Try and get used to those places before you need them. Familiarize with as many that you can. All right.
Yes, sir, noted, sir. Thank you very much. This has been wonderful. All right, in absence of any questions, we have come to the end of the first session of our day two webinar. Thank you very much, sir. It was very lovely having you.
Thank you so much. Thank you for the honor. I appreciate. Thank you. And I wish everyone good luck in your career, in your pursuit of excellence. Don't get tired. Don't get tired. Keep pushing. Keep pushing. There's
Yes,
a
sir.
way that you put in all you've got, and the universe will just yield to you. And also, you need to be humble. Be humble and be open. Be open. Have that open mind. Be curious. Ask questions. Ask questions. All right. All the best. Thank you so much for having me.
Thank you, sir. Everyone, say thank you. Virtual applause for our teacher, please.
Thank you.
All right, so we're moving on to the next session of today. Like I said earlier, each session is 40 minutes, and we have question and answer session for 10 minutes. So as she's teaching, yes, it's a female, please prepare your questions down. Okay, so now I'll be sharing my screen so I could read the citation. Can we see my screen? Please, if you can, react. Can we see my screen?
Yes, we can see your screen.
Yes, we can.
Thank you. Thank you very much. All right, so without taking any more time, I'll be reading. Please let's just get our claps ready. Ms. Faidat Olajide is a clinical neurophysiologist, a AHCS accredited and a member of the Association of Neurophysiological Scientists. She is the co-founder of Vitacura Healthcare, committed to advancing healthcare education and workforce development. Through innovative training programs, career mentorship, and community health initiatives, Vitacura Healthcare has empowered over 100 healthcare professionals and aspiring clinical cardiac physiologists within its first year. Driven by a passion for excellence, she strives to bridge clinical practice, education, and community impacts, creating opportunities that improve healthcare delivery and even inspiring the next generation of healthcare professionals. I'm sure we all heard what I said and what I read. So with a virtual applause, a loud one, imagine it's loud in your head. Please let's welcome Ms. Faidat Olajide. Ma, the floor is yours.
Hello, everyone. Good evening. I am Faidat Olajide. Thank you so much. I didn't get your name, but thank you so much for that
I'm Fumbi,
wonderful
ma.
Fumbi. Nice to meet you, Fumbi. Thank you so much for that wonderful introduction. That's a lot. I'm presenting from home today, and my toddler might make a few appearances, so please bear with me. All right?
Yes, ma'am.
Thank you. So may I share my screen?
Yes, please.
All right. Good evening, everyone. I believe we can all hear me.
Yes, ma, we can hear you, ma.
Thank you so much. That was a very calming voice. Thank you. No matter how many times we do this or how old we are, we still get nervous sometimes when we present, but we have a wonderful way of talking it in. Thank you for having me today on your second day of the physiology webinar. And I hope I would pass a few messages that would impact one or two people today or assist you in your journey as a physiologist. I will be discussing the pathway into neurophysiology. The presentation by Mr. Adebola is always enlightening, and he always delivers it in such a wonderful manner. I might not be saying as much or doing as much because he has covered it all, even if it's a branch of physiology. It's still, all the advice he gave still applies to every other aspect of the physiology. So now, we'll be discussing what physiology means. We'll be discussing the EEG and brain monitoring aspect and also other neurodiagnostic procedures. And we'll also discuss the skills and training that is required for neurophysiology and opportunities in the UK and outside the UK. So what is neurophysiology? Can we hear me, or I need to speak a bit louder?
We can hear you loud and
Thank you
clear.
very much. So neurophysiology, everyone knows, is neuro, then physiology. Physiology is study of the function of the body. So neuro is just picking one part of the body, that's the nervous system, and studying that in-depthly. You know how they say that a jack of all trades is a jack of no trade? But if you specialize in one thing, you become way better at it. I can attest to that because for a few number of years at the beginning of my career, I was a jack of all trades. I was into cardio, neuro, respiratory, sleep. I did it all. And that was me, you know, my hunger for wanting to be something or do something or impact something into the society without having a specific thing exactly. But after the job in the UK, it's been one part, and I have seen myself become way better at what I do. And I can see myself giving not just something, but a particular thing to the society, which is what we should all strive to do in life, okay? So as a clinical neurophysiologist, I work with the NHS right now. So most of the things I'll be saying is based on the NHS, and also with the little knowledge I have for the number of years I spent in Nigeria as a jack of all trades in physiology. I would pitch in one or two things I also learned in that journey. So I'll investigate some of these conditions, or most of these conditions, which includes epilepsy, which is the primary focus for EEG investigations, peripheral neuropathies, nerve entrapments, most especially the carpal tunnel syndromes, MND, that's the motor neuron diseases, myopathy, and neuromuscular disorders. Sleep disorders, I won't say I am involved in that as a neurophysiology. Like Mr. Adebola said, he believes that sleep and neuro are like intertwined. That's because when you are carrying out sleep investigations, you need to carry out some level of electroencephalography. However, here in the UK, there are not most of the hospitals here in the UK do not have these two departments together. They are very two different departments and work separately. So a knowledge of EEG is very good for those that would eventually want to follow the pathway of becoming sleep physiologist. Working in the NHS is one of the largest employer of the clinical neurophysiologists in the UK. In Nigeria, the private sector is actually one of the largest employer of neurophysiologists in Nigeria. And that's because they feel like if they have the fancy tests, the big test includes the MRI, the CTs, and all of that. And then the EEGs, the spirometry, they come as second class. While the basic ones that every diagnostic company wants to have, that's the private sector, includes the blood test, the ECG, which is very much important, and maybe the X-ray, but not necessarily. So EEG comes in as second class. So they are the largest employers. However, they are happy to have neurophysiologists as part-time workers or contract staffs rather than full-time staffs. That's my knowledge of this field in Nigeria with the number of years I spent in Nigeria working as a jack of all trades in physiology. We are an integrated multidisciplinary team because we work with other disciplines. So neurophysiology is under the body of neuroscience, and neuroscience has a lot of branches, which includes neurology, neurosurgery, pediatrics. Pediatrics is very different because pediatrics is a very special department. They are very fragile because we're talking about children, and the things we find in children or in the pediatric EEG or studies is quite different from what we'll find in the adult studies. So the adults, we just term the general term, that's neurology or neurosurgery. But for pediatrics, you have to put pediatric this, pediatric that. So we just say pediatrics in general. Another good thing about working with the NHS, or one of the things with the NHS is, like Mr. Adibola says, you always learn on the job. In Nigeria, learning on the job just simply means learning with the patients you see, with the investigations you carry out. But I'm sorry if I'm saying too much about the UK because that's where I work and that's what I know. So I'm sharing what I know with you guys. So yes, the structured training in the UK when you work in the UK. So the training includes the CPD, that's continuous development studies. We have stats and MANs. So you always have to do courses every year or every 6 months or every 3 years to just keep yourself informed. Now let's talk about EEG. EEG is the record of the brain electrical activities. How do we carry out EEGs? We place scalp electrodes on the scalp and we record for, depends, I'll get to how the length of recording, because depending on the length of recording, it gives a different name of that type of EEG. We carry out activations, which includes eye open, eye closure, hyperventilation, and photic stimulation. Why do we do all of this? We're trying to stimulate the brain. We're trying to get the brain to work. We're trying to get the brain to react to these things that we are telling the patients to do. And we do these things so that we can see the changes that happens in the brain. And when these changes happen, there are some readings that we say are normal. There are some that we say they are benign. So they are really not bad, but sometimes it can happen in some set of patients, some type of condition, some patients with some genetic disorders or something like that. For example, in pediatrics, it's normal to see slow waves in pediatrics because their brain is still developing. But in adults, you don't want to see slow waves that much. You will see them, but not as much as you would in pediatrics. So there's a lot to understand when it comes to, the EEG. It's not just a 20-minute or 1 hour recording and that's it. So we have the standard EEG. I've explained what the standard EEG is, but that goes for about 20 to 30 minutes. We say 40 sometimes because it depends. In pediatrics, we carry out the recording for up to 30 minutes because, they move a lot. There's a lot of artifacts. So you want to get a longer recording and see if you can get longer periods of stable recordings. Ambulatory EEG are those that are prolonged. They are either from 24 to 72 hours. Under standard recording, we have sleep also. Sleep recording. The sleep recording is divided into two. We have the sleep deprived and we have the sleep induced. Sleep deprived is what we usually use for adults because you can tell adults to please do not sleep for more than 2-3 hours overnight and come in the morning and get the EEG done. You sleep in the department during the test. So that's done for about an hour. For the sleep induced, you can't tell kids to stay awake overnight. So mostly children we tell to come in and we give them melatonin. We all know what melatonin is. It's an hormone that's found in our body that helps us to get tired and go to sleep, following the circadian rhythm and all of that. So now we give the medication and this gets them tired and gets them to sleep. It has no adverse effect. It has no side effect. They sleep, they wake up like they're taking a nap. Some do not sleep. Really doesn't matter. We just get the recording. And if we don't get enough information that is required for the doctors, then they have to come back again and we try again. If we see that we're doing it too many times and maximum of twice, then they have to do other investigations or the doctor just has to decide on the next level of treatment. Ambulatory, it's about 24 to 72 hours. In this case, it's for patients with rare conditions or rare events where they say, oh, I only have my events maybe when I sleep at night, or I have my event once in 5 weeks, or I have my event, the events are not quite frequent. The events are not, the doctors are not very sure of the display or the characteristics of this event. So they want to get more information. So in this case, we do the prolonged ones. So we call it ambulatory, but they are branches. We have the home video telemetry. 1 minute, please. Hello. I'm so sorry about that. Like I said, my toddler will make appearances and she needed me for a minute. Okay. So I'm already doing too much talking on exactly what this is or on exactly what EEGs are. And I don't think you need all of that information now. But I'm doing this so that you know that it's a fun and very interesting career. So we have the video telemetry, which is longer and is usually inpatient and it's for epilepsy surgery workups. So for patients who have epilepsy, I want to believe that everybody here has good knowledge about what epilepsy is, and it is not something gotten from a lizard or your auntie's curse in the village or your village people attacking you or things like that. It is just something happening from the brain due to a damage to a specific part of the brain. Am I right? Can I get a yes or a no to that?
You're right, ma'am.
Okay, thank you very much. But I'm glad we passed that stage. Okay, so because honestly, it's quite interesting with the way it used to be back then in Nigeria and the stigmatization. I'm very thrilled when I see patients coming in with boyfriend or my girlfriend, and they know that I have epilepsy, you know, and they're like, "Oh, I know she has epilepsy. This is what our events are like," and they're the ones speaking for her, speaking for him. It's encouraging to see that life is evolved. Anyway, life in the West is always well involved than back home. So I'm glad that here we are well informed. Okay, so let's move on. Yes, so now neurodiagnostic procedures. Aside from the EEG, there are other procedures that we do as a neurophysiologist, something we call EMG. However, before you can carry out EMG investigations, you need to have mastered neurophysiology. When I say mastered, I don't mean just a master's. You must have had, you must probably already, you should already become a doctor in neurophysiology or a consultant in neurophysiology. Or maybe that's how it is here in the UK only. But in Nigeria, no physiologist can carry out EMG, I believe, except things have changed. But for the little information I have so far, I think physiologists cannot carry out EMG because EMG is quite different from nerve conduction studies. EMG includes the use of needles. In the NHS, you need to have carried out courses and trainings on how to use needles. That's funny, but yes, on how to use needles because it's very delicate. Don't forget that EEG is non-invasive. You don't use needles, and it is a very simple test. However, there are other types of EEGs that includes the intracranial ones where they use needles. And in those ones, sorry? Is someone asking a question? Okay, I'll just go on. But it's good to have knowledge about it, okay? Nerve conductions, yes, you carry out that, and it's very interesting. Nerve conduction studies are quite interesting. It's the study of the nerves. We just want to see the speed and the strength of the nerves. So we want to see how fast the nerves pick up signals, and these signals are electric shocks that we give to patients on the different nerves. So you need to know your physiology, the nerves of the hand, the nerves of the upper limbs, the lower limbs, the neck, etc. You need to know all of that, and it's quite interesting. You see the speed of, for example, the ulnar nerve picking up the shocks on the finger all the way to the elbow, to the armpit, and to the neck. Very interesting. This I cannot explain this way, and that'll be like giving you the full course of an EEG of nerve conduction studies. Evoked potential, these ones are optic nerve functions. These ones are for the eyes. Visual evoked potential. We have the somatosensory evoked potential. We have the brainstem auditory evoked potential, and we have the IOM, which is very interesting. You know that you can specialize in just IOM and not any other thing, just IOM, and that is very lucrative. They cash out a lot in that field. It's a neurophysiology field, and they do cash out a lot because I am interested in making money, and I'm sure everyone here is. So if you want my advice, learn the EEG, learn the evoked potentials, learn the nerve conductions, and if you have that time, especially the men, if you have that time, learn the IOM. That is gives a very beautiful work-life balance, and you make a lot of money. Now let's go on the skills and training pathways. As an undergraduate, you should have a BSc in physiology or any neuroscience course or biomedical sciences. Sometimes they accept biological science, which is a life science degree. Give me 1 minute, my love. 1 minute, my love. Postgraduate entry, you could also decide to have an MSc or PGD, like Mr. Adibola said, just have a PGD is better than going for a master's. However, if you live in the UK or you have some sort of, benefits of schooling in the UK, not schooling as an international student, I'm speaking in general now. If you have the benefit of schooling in the UK, but not as an international student, you have other pathways to gaining a master's degree in neurophysiology. 1 minute, my love, through an NHS scientist training program, which lasts for 3 years. You'll be paid as you work, and you'll be attending classes. You work, you go to school, and you're getting paid. So you are not missing anything. You're having the time of schooling as time of experience also. So it helps your CV. You have to register with all the necessary bodies because you cannot work in a hospital without the necessary registration. They won't accept you. However, as an international candidate, they might allow you to come into the country without the registrations, but you need to register within 6 months of arrival, which is very good. And as a neurophysiologist, they accept that. I don't know about any other physiology field, but neurophysiology, they accept that, which is very good. All you have to do is start the process of registration before you arrive or before you even begin to apply for jobs, so that when in your CV, you can put it there as in progress. And because that's one of the criteria before they even pick you for the interview. So when they see in progress, they still accept to listen to you. The CV is like sugar attracting the ants. And when the ants come closer and they taste the sugar, it now depends. Do they like it? So they accept you, they filter you out of all the candidates, accept you for the interview. Then you do the interview and they listen to you. If you make sense and you sound like what they want, then they accept it. Now you need to decide. You want to specialize in just EEG? Do you want to specialize in EEG and something else? Or do you want to go into IOMs only? My advice, if you want to do IOM only, just do EEG and stick to IOM. If you want to do EEG, don't stick to EEG only. The world is evolving. So do EEG and EMG. In EMG or nerve conductions, or do EEG and EMG and evoked potentials. Or you do EEG and evoked potentials, because as life goes on, the job market is going to be asking for more than just EEG, okay? Because EEG will eventually become like ECG that even the HCAs, healthcare assistants, can do. Now, the advanced practice, my love, just give me 1 minute. The advanced practice, which is the higher specialist scientist training here in the UK, are those that go on to doctoral levels. That's like the PhD in neurophysiology, and you become consultants. In those roles, some of these people are able to carry out EMGs, like I said earlier on. Okay. Career opportunities. I've said so much about the opportunities or the benefits of working in the NHS, directly or indirectly. However, the NHS is the public sector here in the UK. Public sector in Nigeria is LUT, LASUT, all the federal and state hospital. That's the public sector. And yes, they open advertisement, I think every 2 years or every 3 years or every year, I don't know, but just always look out in the newspaper. They don't do the loud ones on social medias. They do the archaic ones, the newspaper, they know who. So if you know somebody that knows somebody, so always keep your ears out there. And they accept from entry levels in the public sectors in Nigeria. In the NHS, the entry level is a band 5, which is quite good and fair because the entry level for nurses is probably a band 2 or band 3. So yes, your pay will be substantial enough for you to live in the UK or live in any part of the European countries. While as a scientist, so there's a difference between neurophysiology technologists and scientists. Technologists are those of us that trained without having to, go through the STP programs or the master's programs. So we start from a band 5. However, if you've already written the master's and all of that, and you've got the experience of a number of years, there's a cap years, you start from band 7. Then you become consultant at a band 8. Okay. There are some departments that separate adult and pediatric neurophysiology. So you might see job applications that say pediatric. Pediatric is very interesting, but it's very different from the adult. So they want people that have experience and actually know what they are doing, because you cannot say, oh, you do EEGs on everybody. You've done EEGs for a number of years, and they give you a pediatric EEG recording and you say this is abnormal. You need to know these things. So pediatric is a very different specialty. Sorry, please give me a minute.
As we're waiting, I hope we're taking notes of what she's saying and preparing our questions down. Thank you very much, Mary. Is there another person? If you're still here, please react. Okay, good. Very good. Please mute yourself. Okay, so everyone that is currently listening to me, please, as we go on, occasionally please check your mics in case you get unmuted, so we don't disturb the lecture or class rather that is going on, so others will be able to focus and concentrate. All right, thank you so much. That's clear.
Okay. Mommy's in the meeting. 1 minute, my love. I don't know if my screen is still shared. Sorry about that. Hello?
Yes, ma'am, we can hear you and see you clearly.
Can you see my screen?
Not the slide, but we can see you. We can't see the slide.
All right, let's share that again. Now? Yes, my love. Yes, you did. Good girl.
Yes, we can see you, ma'am.
Thank you. All right. So, like I was saying, please let me finish this one. Yes. Okay. All right then. So I think my time is nearly up. So I'll just move on. And if you have questions, we can always come back. So you know that you can work in the public sector, private, you can also be independent, but that is a long journey. And if you start now, you can get to it before you know it. You can also work in research and academia. Research includes working in pharmacies, medical device companies, electrical clinical trials, etc., etc. Okay? So let me just give you a day in my life as a physiologist. So you wake up in the morning, you go to work. By 8, we have these morning handover meetings that we do. So we check the referrals, check the patient list, we prepare our schedules for the day, and we start our clinic by 8:30. 8:30, we do the EEG clinics. We carry out about 2 to 4 EEGs, and we report them all. So you need to learn how to also write a factual report. Factual report just means writing what you see in the EEG. It's not writing a diagnosis or giving a final conclusion. Then you have lunch, and then you go for the NCS clinics, the nerve conduction clinics. In those ones, while you're doing the clinics, you're writing the report at the same time. And when you're done with all of this, you give them off to the doctors. So you work hand in hand with neurology doctors or neurophysiology consultants. Okay. So my advice for you all as neurophysiologists is to understand what the brain stands for and the nervous system. If you understand the connection and the link and all of that, it will just make it easy for you to pinpoint, or, when you start the trainings, it will just make it easy to understand exactly what you're doing and why you're doing what you do. Get clinical exposure. Mr. Adebola has said it, so it's just like me repeating the same thing 1,000,001 times, but I know we all heard him say it. Get exposure. I did that with my mentor, Mr. Bankole. I'm sure most of you know him at LUT. I did that with him. I did that also with Mr. Badamosi. I was a jack of all trades, so I did that with Mr. Badamosi for cardio. I did that with Mr. Bankole for neuro. We were the first set to have this EEG beginners course at LUT then. We were the pioneer for that course, and I feel so proud of it. It was one of the certifications I had that helped me in getting a job in the UK. I'll talk about that when we get to question and answers because my time is gone. I also did the spirometry training with Dr. Forgotten the name now, but it was through Mr. Badamosi. And it was quite interesting because I was just doing follow, carry. Anywhere they're going, I'm following, I'm carrying, I'm following, I'm carrying. Anything, I'm going. Even when Mr. Badamosi says the job is maybe on the island, I am going. Oh, the job is an overnight job. I am asking my dad because I'm gonna get inside daddy's girl. Daddy, I have to go. I am going. To the extent of, going to Lasut for echo trainings. And I went all the way to Uyo because I thought my path was going to be in cardio eventually. I went all the way to Uyo, the Uyo course that Mr. Debola mentioned. I did that. I only finished the first part. Before I was done with the first part, they gave us, what's it called now? What's this thing we do at the end of the year? Thesis, presentation, what's that called? I've forgotten. We were supposed to do something like pick a case study and write a lot about it and get some, echo diagrams and all of that. I was on that path before I moved to the UK. So yes, I was doing and doing. And like Mr. Adebola said, just keep doing, keep moving. And the world just has a way of, realigning your steps and giving you what you want. And don't forget, be humble. Eventually. So another thing I would advise is choose your path. I didn't choose a path. It was the universe, God, because I'm a very good Muslim, alhamdulillah. Allah just decided that neuro is my path. So I got the neuro job and I have been on that path ever since. Build your network, join all these bodies, go for the meetings. Personally, I not go for any meeting. I not join anybody before I moved to the UK. It was when I moved to the UK, I joined all these bodies. And now the bodies are quite interesting. They have courses, they have programs, quite nice things that I attend, and it's mostly virtual. So I don't need to travel anywhere. I don't need to go anywhere. I do everything virtually. So they know the name, but they might not know the face because I'm a bit shy, but not very shy. So yes, that kind of thing. So don't say, oh, I'm shy, so I don't want to go anywhere. I just give you an example of, what you can do. Embrace lifelong learning. You cannot know it all. I am still learning. some cases come and I'm like, what is this? And I have to pick up a book and read about it. You learn every day. Listening to Mr. Debola, I learned a lot. I attend most of these things anonymously, listen to them. We have the Vital Cura course, because I'm a co-founder of Vital Cura Healthcare. We have courses we do. I'm no longer on the cardio part, but I learn every day. I'm taking courses, I'm teaching you courses in Vital Cura Healthcare's ECG course. I am teaching you courses. So you see, I haven't left my base. I'm using my base to make things happen for people, to impact people's life, Then think globally. For EUG, ABRET is the certification that is accepted in America. And if you have ABRET, you can apply for Canadian residency and then walk into getting CBRET, which is the Canadian part of ABRET. Make sense? There are a lot of opportunities for neurophysiology. You just need to tap into it, okay? I'm just moving on and moving on and moving on. So with all of these few points of mine and my interruption for my beautiful little toddler, I am so sorry about that. I hope I have been able to, share one or two things about becoming a neurophysiologist, and I hope it really helps you in your journey. Don't forget, neurophysiology is quite rewarding, and it's not just rewarding. You know how AI is taking over everything and technology is doing everything and everything? Neurophysiology is actually an intersection between all of this. So trust me, if you study neurophysiology, you are not going to go out of date in the next 15 years. You will just keep evolving. Thank you very much. And it's always a pleasure delivering these speeches to you all. If I can begin to take your questions, I'll be happy to.
Great. Thank you very much, Ma. Thank you very much, and that was very, very informative. You mentioned Dr. Badamosi, which means did you study at LUS or you came to do COS at LUS?
What's yours? Sorry.
Oh, it's like IT.
Okay, yes. So this is question and answer now. Yes, I can talk a bit more. So what's it
Oh
called?
no, I'm just curious.
Yes, I came to do IT at LUT. So I studied at Lautech. We have 1 year IT program. So I went to LUT, and I don't even know how. You need to know someone, but I don't know how I got to know Mr. Badamosi, because I just went to LUT, and I don't think it was Mr. Badamosi I knew. I think it was one of the profs in the medicine I knew that now directed me to Mr. Badamosi to learn, saying that is where physiologists go to. So I started training with Mr. Badamosi, and he became my mentor. From there, when I told him I wanted to explore other branches, he introduced me to Mr. Bada, then also spirometry. So my 1 year at LUT, I made sure I was all round. And after that, during the NYC period, I think I was the platoon leader. So they asked me, where do you want to be posted to? And I was in Lagos. So as the platoon leader in Lagos, and I'm asked, where do you want to be posted to? I said, LUT. And so I got LUT posting. And then I just continued my journey that I already started at LUT. And that was it. Just kept going from there.
Thank you very much, Ma. I've stored that in my brain. All right, so someone has this question. As a 200 level physiology student, the person is currently in 200 level. Is there any EEG training or certification program a person can take? Hello, Ma. Should I come again?
As a 200 level, say that again.
Physiology students.
Yes.
Is there any EEG training or certification program that the person can take, that I can take?
Certifications. So I know Activus. That is Mr. Bankole. He does some EEG certification programs. So if you have any way of contacting Mr. Bankole, or maybe contact your anchors here, and they will share his contact with you. I think he does the course once a year. So you can reach out to him. That is now. However, Vital Cura Healthcare would be starting the EEG programs very soon. You are still in 200 level, so definitely you still, oh my God. So you're still in 200 level. Before you get to 500 or before your graduation, definitely Vita Cura would already start the EEG courses. We want to make sure that our courses can be verified even outside the country. So we're taking our time to set this up properly so that when you share our certificates with your employers from any part of the world, it would be verified as being authentic. So, but for now, I know Activus does. You can reach out to your anchors and they should be able to assist you. But regardless of that, it might be quite expensive for some people. You can begin to watch these courses online on YouTube. There's this guy on LinkedIn that I started watching even way before I became a neurophysiologist. And now he's built his own EEG machine. So imagine me watching this guy right from when he started his journey till now that he's built his own EEG machine. You should understand how much I must have learned from him without paying a dime. So you can learn from these people. If you join these platforms like LinkedIn, there are quite a number of people that post things on LinkedIn, case studies, basic things about EEG. You should start from somewhere. You can learn from there before you move on to the big guys. Okay?
Okay, ma. And it's duly noted, so we should connect. Okay, for those on YouTube, please keep your questions coming in. Feel free to ask questions. There's another question.
No.
Could you please talk about surgical neurophysiology?
So surgical
What does it mean to-
neurophysiology
Yeah.
is the one I mentioned as IOM. It's called intraoperative monitoring. So IOM, they are basically part of the trauma team. When there are cases of trauma incidents and they go into surgery, they monitor the EEG, the brain activities, to inform the doctors of changes that occur when they cut a nerve, when they give a form of anesthesia, when it gets to a level that the brain is too slow or the brain cannot take it anymore, when to stop, when to take a pause, when to move on. So it's just like what are those guys called that watch the ECGs? I don't think anybody would necessarily watch the ECGs because those ones just beep or something. I'm not sure. But I don't know so much about ECGs in surgery. So there are those guys. So those are the IOM. That's the one I said they really cash out. But don't forget, in as much as they're making so much money in that field, and it's quite friendly for balancing work and family life, it's tedious. You can stand in the surgical room for 12 hours non-stop. Breaks of 10 minutes or 20, depending on how many assistants you have or how many neurophysiologists are in there. So it's quite tedious. So you should know what you're getting yourself into, okay? Is there any other thing I can say about it? You don't perform surgery. I can see the question though. Does it
Okay,
mean
good.
you perform surgery? So no, you do not perform surgery. You just monitor. The same way you monitor as an outpatient, that's during the telemetry or the sleep or the routine EEGs, you monitor. But in this case, it's quite different because you're not monitoring just the brain, you're monitoring the whole nervous system, and you need to know so well about it. You need to know the interaction of the nervous system with some drugs and all of that. So once they put in the drugs or the anesthesia or the whatever, you need to know what should show. You need to know what the brainwave activities should change like. You need to know what the speed of the nervous system should be like. Things like that. You need to be very quick with your thinking and quick to advise your doctors to stop or to continue or to take a pause or to change the medication. So it's quite tedious mentally and physically.
Thank you, ma'am. So this is in relation to what you said earlier concerning the program, EEG program that's going to start soon. So the person is asking, how do we know when it starts?
How did we start?
No, how do we know when the program starts? The EEG program that is coming on.
Oh, so the EEG program for the next one, EEG or ECG?
EEG. Person didn't specify which of them, but you just said program. She said
Oh,
program.
okay. So let me just say all the programs we are doing. So for the ECG, we have the next one coming up in September. That one will be on all our platforms, the LinkedIn, the WhatsApp. We're not on Instagram and Facebook. Those are social platforms. So we're not there yet. We're just on the professional platforms because it's quite, we have a particular target audience. Okay. So if you're on LinkedIn, follow us on LinkedIn at Barter Courier Healthcare Limited. Your anchors would get all the information and they can share with you. So we always post on there. And yes, the ECG is coming up in September. The EEG, like I said, we have not started it now. We're still in the process of building it because we want our certificates for EEG to be accredited and verifiable across the globe. We don't want people spending large sum and eventually not being able to use those certificates, maybe in Nigeria or outside Nigeria. All right. When it's out, we'll let you know. And I'm sure we'll still keep contact with the beautiful anchors that are here and we'll share with them. So if they have a platform where they share things with you guys, stay tuned, stay connected to these groups. They'll help you. Okay.
Okay,
There's a
ma.
question here that did my journey in Nigeria help me in shaping
Yes.
what I am doing in the UK? So my journey in Nigeria, yes, it did. Because as a neurophysiologist, we also apply lead one ECG. So yes, my training in ECG helps me in neuro. And also, when I'm writing my reports, the doctors here already see with my reports that this person has very good knowledge with cardio. So sometimes they even ask me what this is, what that is, what kind of waveform is this for ECGs. So yes, it did help in that aspect. And also don't forget, Nigeria work sector is quite different from that in the UK. Nigeria work sector makes you smart. It makes you stay on your toes, which is what you need when you're working outside Nigeria. Not necessarily street smart, but actual mentally smart. So yes, it did help in shaping what I'm doing in the UK. Yeah, it did.
All right, ma. Okay, so it was mentioned that you did careers in physiology, you did cardio, respiratory, and neuro. So the question is, why did you choose neuro?
Is it because of
Was
the
it due
pay?
to passion or the pay?
Is it because of the pay, or you like that the cost? You like the cost better? Um, cardio is broad. Cardio is broad. Cardio is broad. In Nigeria, you cannot be just an ECG technician. It's nothing. The pay is trash. The job market is very low. So you need to know echo. You need to do like echo because the nurses do ECG. So you need to like know echo. You need to know other things. So that was why I was, trying to do more in cardio. But I don't know, because honestly, I would just say because I got a job in neuro. It's not like I chose anyone. It's not like I wanted to choose anyone. Because neuro is also broad. So honestly speaking, I didn't want to choose. I was happy to do all. I didn't want to choose anyone. I was happy to do all, learn all of it, be a pro at all of it. But I just got a job in neuro. So I had to focus on neuro. And I started to grow in neuro and I started to move up the band in neuro. So I'm like, just stick to neuro then. So, because even if I try to move to cardio, the question will be, what's your work experience in the UK as a cardiologist, cardiophysiologist? And I didn't have any work experience as a cardiophysiologist because experience is very key when you're working here. So I just picked it because I got a job in it. But they're all quite interesting and they're very good.
Okay, ma, there's another question.
Is
Ma,
there an
can you hear me?
intersection between clinical? Yeah, I can hear you.
Okay. Okay, ma,
Should I
answer this,
read
then I'll
it?
ask the question.
Okay. Is there an intersection between clinical neurophysiology and neuroscience research? Can I function as both? I have been at the crossroad on this. Neurophysiology, neuroscience research. Yes, there is. But You cannot be in both. You cannot function as both. I have a senior colleague here that would love to further in neuroscience research. However, he is a consultant neurophysiologist. So now he wants to sit back at home, focus on family and life while, venturing into neuroscience research. Though he has written some papers in the past and some things in the past, but he did that on the job. So that was like clinical research. So it's not a broad neuroscience research, it's clinical neuroscience research. So you need to, I don't know what best advice to give, because you can actually just go straight into either you just go straight into clinical neurophysiology or you go straight into neuroscience research. Both of them are very lucrative and they are very interesting. They have very good prospects as a physiologist. So you can pick one of that. But if you want to do both, I believe you'd need to gain experience. I don't know, honestly. That would be very stressful doing both. It would be very stressful doing both. But honestly speaking, it depends on your strength and determination. You can do anything you want to. Nobody should tell you, no, it's not possible. That's what I'll say. But there are two different ball games, but they are intertwined. Yeah, that's all I can say. Does that answer your question? Hello?
I believe you should have answered the question.
Okay.
Okay. Someone asked, is there a way to study and work in another country, for example, Italy?
Yes, there's always a way. It's not only
Okay.
the UK, it's not only America, it's not only Canada, it's not just these regions. There are job opportunities everywhere. What's the name of this country? Australia. Australia is getting a lot of people now. They're asking for so many now with good pay, good bonuses. So yes, you can. Where do you find these jobs? LinkedIn, Track. Where else? Indeed, you find the jobs there. Just put your region, the region you want to find the jobs, and the job title, and just search. You find them. They don't use big names when they are putting up the job post. They use straightforward names: EEG technician or EEG technologist, ECG, or clinical neurophysiology. That's all. So can.
Okay, Ma. Ma, there's another question from YouTube this time around. How can, or rather, how do I start my journey as a clinical physiologist after my BSc?
Clinical physiology is broad. Do you want to specialize in one, or you want to be like me, jack of all trades? If you want to be like me, like Mr. Debola said, volunteer. Volunteer.
Cardiac
If you have
physiology is the
cardiac,
person's niche, yeah.
cardiac. So if you have a diagnostic center next to you where you live or close to where you live and they do ECGs, walk into the place, volunteer. Just tell them that you're an undergraduate, you want to learn, you live close by, they'll be inspired by that kind of energy because nobody does that. And you don't want to be paid. You just want to come in and see and learn. And they would accept you if they can. Just work for them. Change the sheets, like you said, get there early before the physiologist there or the doctor there or the nurse there. Respect them. Tend to give less of your opinion about what they do because some of us like to feel like we're physiologists, we know it all, and you want to start correcting the doctors. No, just stay on your lane and watch and learn. Ask questions. Ask questions all the time. Volunteer. That's it. Then when you're done with school, you volunteer. And if you volunteer in public sectors, once there's a job opening, you find out and you apply. then you can get it. Sometimes the private sectors even have. So if you volunteer and you're humble, you can see some of these people assisting you with getting jobs in the private sector because there will be openings and it's a word of mouth thing. Once they're in that field, somebody tells somebody that they are looking for somebody, and they'll tell you. So volunteer is the start, my dear. Volunteer, watch these programs on YouTube, on the social media platforms, and learn. Okay? And attend these kind of programs.
In relation to what you just replied, a question was asked. The person is in 200 level physiology, and he or she is asking that hope it's not too late to start working towards becoming a neurophysiologist or any other area of physiology? And if so, what can they do to start
Okay,
getting involved and working towards the goals?
all these things I said is how you can start.
Exactly.
Volunteer, attend these programs. Most of them will be free. Most of them, they can't pay you. Some might say they'll give you something for transport, but don't be bothered about the pay. Mr. Adebola has said this. Just volunteer for a start. Let your parents spend that money now for a start. If you need to, when you volunteer and you're in the program and they see your interest, they start pitching to you. Because it was while I was volunteering that they pitched to me, oh, there's this course they do at Uyo. I will connect you to somebody. They will explain it to you better. They will tell you how much it is. Let me know if there's any way we can assist you with the pay. Like that, gradually, you see yourself. Be humble. Like you said, be humble, volunteer, and you'll find yourself in places you never imagined. Then join these groups, these platforms, listen to these programs. Yeah, that's what I can say. Don't worry about
Thank you.
networking or attending conferences. You can do them online, remotely. Okay?
Noted, ma. All right, ma, can a physiologist work remotely as in telemedicine?
Yes, you can. But you need experience. So imagine you just graduated and you want to work remotely. It's not possible. So as entry level, you need clinical experience. You need substantial clinical experience, not 5 years, not 10 years. You need substantial clinical experience. Substantial in the sense that you can now write reports. So you have studied clinical physiology of any form to consultant level. That's if that is your dream, you know. But if you want to work in telemedicine, the best you can do as a physiologist, it won't be a remote job per se. You need to go to patients, visit patients. Because I've done things. I also worked in telemedicine. It is called Mobi Health. They are still very functional. So I worked with them for a while. In these situations, you have to visit the patients and carry out the EEGs on them. So it's no longer remote. You are going to patient's house, no? Or you are going to visit the patient wherever they are. So yes, that you can do. And if they have that kind of telemedicine advantage in Nigeria, yes, you can. But I don't think they do that in Nigeria now. The only people that benefit from working remotely on telemedicine are the doctors because they just have to see the patient over the phone or write a report online. That's it.
Noted, ma. All right, so we have 6 questions left in the chat box, but I'll pick in just 3. I'm so sorry, everyone, due to time. Now, someone is currently doing the IT presently in Lutz. What can he or she start doing now to build themselves in the journey of becoming a neurophysiology before graduating to make it easier? And what can he or she do immediately after graduating to prepare for the opportunities abroad?
Now that you're in Lut, don't just go for your IT because you have to. Be in it. Learn how to record, report, know the different, if you're in cardio, know the different ECG types, the ECG on certain, because there are some very common, there's some very common abnormalities seen in EEGs and ECGs and all of that. Know the common ones.
building yourself or preparing yourself for the opportunities abroad, you just need to build yourself for yourself and for becoming who you need to be. Because let me tell you something about getting a job outside Nigeria. They don't ask you interview questions that are hard or crazy, or, they don't ask you questions that you cannot answer. They ask you basic questions that they expect someone who has had, if their request is 3 years experience, they just ask you basic questions that they expect someone who has done this job for 3 years to know. For example, they show you an EEG and say, report this EEG. It's for you to say whether it's an awake or asleep EEG, and that's it. They know you know what you're doing. They show you something and they just ask you, what do you think this is? They will expect you to either know it or not know it with the number of years you claim to have had as their requirements. Maybe you tailored your CV to their requirements, so they expect that you should be able to answer the questions. And the funny thing about their questions, they only ask you clinical questions, 1 or 2 clinical questions, and the rest is social questions. So while you're working at Luth, pick point on those characters, the socialization skills of the doctors. How do I explain this? What do you do when a patient comes in and the patient is aggressive? Learn what you're supposed to do and be kind. Learn whatever your team lead, your head of department says. Just know it, be in it, because these questions are just going to be life questions, like natural questions. So there's no big preparation. Then, like I said, just try to get yourself into one or two of these regulatory bodies in the country of your choice. If you choose US, just make sure that you're already in preparation of writing your ABRET or something for EEGs. Just be on their list. You don't need to even write it yet. Just be on their list. If it's the UK, there's no exam. Those ones just have bodies like the ANS and the likes. Just be on their list, You don't need to do too much. Just be on their list. Don't pay because you don't even have the money. Except you have the money. Things like that. Just be on the list. Okay? That's the best I can say you should do. Be in
Okay,
it.
ma'am.
That's it. Thank you.
Thank you. So I believe this has answered the question from YouTube and also the person 100 level. Don't stop praying for opportunities abroad. Now there's another question. What can a person interested in biotechnology? Okay, this is quite tricky. Let me read how the person wrote it. What can be a career for a person interested in biotechnology but studying physiology?
In biotechnology, or studied physiology, if it's a he or a she, that's a very, very good question. And that's a good path to take, with the way the world is evolving. Biotech is like the future. However, I really don't know the link between physiology and biotech. But I know someone who is a physiologist, but in academia, in research, and now is into biotechnology. So maybe when you're done studying physiology, focus on the research aspect of physiology and find your way to biotech from there. Because if you decide to go neuro, cardio, respiratory, I really don't see any direct link to biotech, but I stand to be corrected.
All right, thank you very much, Ma. Last question. This is going to be a 2-in-1 question. So the first part of the question is, where can I get in contact with Activus Healthcare? And I'm going to put it together. And the list of places, or rather website, that you can get jobs.
Activus Healthcare, like I said, your anchors, yourself, Miss Boss Rest herself.
Ma, you can say Fumbi.
Miss Fumbi. And the
Yes,
gentleman that's been in contact with me for a while now, they should be able to share that information with you. I want to believe that at the end of this course, you should get a mail or a message, a thank you message or something with a list of all of these things to help you guys in your journey. So yes, that answers that question. Where can you find jobs? You can find jobs on job platforms, job search platforms. There are lots. We have Indeed, we have LinkedIn, we have Track. We have NHS UK jobs. We have, those are the ones I can remember now. But just type on Google, whatever job, and it will bring out all the options, even the ones that are sponsored. Okay, does that help?
Yes, ma, it really does. It really does. And this is B part of the question. Your advice for someone who wants to specialize on epidemiology as a physiologist.
Epidemiology is another branch entirely, which I am still
Entirely.
waiting to see someone or meet someone studying that or in that field, because it's different. It's like all in one, because that's epidemic crisis study. So that's different. They have to study everything, but they are not studying the diagnosis. As a neuro, as a cardio, as a respiratory, as a sleep, you are studying diagnostics. You are studying how to say this person has this condition. Let me be that lane. But epidemiology is different. You are studying how this virus or this thing can, affect the whole nation, how it can cause a setback. What do we do? So that's like a different ball game. That's very different. It doesn't align with whatever I studied or whatever Mr. Debola studied. Okay? So that's a very different ball game. I'm sorry I can't help you so much with that. But that's a good path to take because the world is evolving. So we need to do better than just the norm that everybody is doing now. So biotech, epidemiology, please, if you have interest in all of that and you're studying physiology, know that you have to do more study. You have to do more studying. You don't just stop at physiology to get there. Okay? Thank you. Does that help? Does that answer the question? Is it in public? It is in public health, yes. So you see, Mr. Balamosi already answered that you go for masters in public health. So it's in public health. And I don't think we should have bodies for physiology graduates in Nigeria. We have so many. There are so many I see, so many different WhatsApp platforms. But you need to, don't just dissolve yourself into them. You are there for networking. You are there for connecting. You are there for gaining knowledge to know what to do next. Yeah? But there are no registered bodies that is recognized in Nigeria. Okay? Miss Fumbi, I think that will be all for now.
Yes, ma. However, before I let you go, there's this particular question that's super important for a lot of people that are interested in your story. So, after your BS in physiology, did you first obtain a master's degree before getting a job abroad? Or did you relocate abroad and then pursued further education?
So, the truth about this is how I did it is not how it happens. It's not the best way that works for everybody. You can finish your BSc now and get a job in the UK. That's why when I was presenting, I showed you different ways you can actually get the jobs in as neurophysiologist. So yes, you can decide to start applying for jobs immediately, even before you're done with school. That's in your 500 level, final year, probably last semester, you can start applying for jobs, Sorry, love. You can start applying for jobs, knowing what your CGPA will be. You can start applying for jobs and you will get a job, a very good one. That you go in as a band 5. You can decide to take your time and write your master's here or decide to write your master's abroad. But writing your master's in the UK does not certify that you will get a job in the UK. That I can tell you for sure. You might write your master's in the UK and not get a job as a physiologist in the UK. So don't say you are going to the UK to, to have your master's done and then get a job automatically because you've been in the UK. No. All right. So you can decide whichever way. You can even write your master's in Nigeria and still get the job and go to the UK. Okay. The one I was saying in my presentation is, some people are citizens of the United Kingdom, but they live in Nigeria. You can go to the UK and enter into the STP program. That way, you can have your master's and work experience as 2-in-1. That was the one I was explaining. So they're very different ball games. So just depends on what works for you. Don't start late. There's nothing like starting too early, but don't think you're starting too late too. If you're in school now and you want to start applying now, and this is your final year, start applying. You cannot start applying in 200 level. You cannot start applying in 300 level. You need to be in your final year, okay? So that it makes sense that when you're done, then you're already in the job. And that's if you also had work experience as an IT student. So that's why I say volunteer, even if you have to volunteer after school every day, so that your number of years of volunteering increases. So if you did your IT for 6 months, but you keep going there, even after the 6 months till you graduate, that'll be 1.5 year experience that you have in your record, which is good. And you keep volunteering for about 6 months to have 2 years experience, and your CV is strong and you can apply for jobs. Don't forget, volunteer. It's never too late. Volunteer, and it's not too early.
I can't thank you enough, Ma. Thank you so, so much.
You're welcome.
Thank you, everyone, for listening. That was a very, very, very insightful session. On behalf of SPAN, Southwest Region Zone D, I sincerely appreciate you for taking the time to share such valuable knowledge and experience with us.
Thank you.
So our participants, those on Zoom and even on YouTube, thank you for your attendance, thank you for engaging, and thank you for asking questions. I look forward to seeing you at the next session. Thank you, everybody. We've come to the end of our day 2 webinar. Sorry, day 2 of our 3-day webinar. Please be here tomorrow. Thank you, everybody, for joining us. You can now leave the call. Thank you very much, Ma, once again. Have a lovely night.
Thank you.
Oh, it's so